Now, what is illness anxiety disorder? Let me give you an overview. Now, illness anxiety disorder, sometimes called hypochondriasis or health anxiety, is worrying excessively that you are or may become seriously ill, even though there is no physical symptoms. So, which means basically it's all in your mental state. Or you may believe that normal body sensations or minor symptoms are signs of severe illness, even though a thorough medical exam doesn't reveal a serious medical condition. You may experience extreme anxiety that body sensations such as muscle twitching or fatigue are associated with a specific serious illness. Now, this excessive anxiety, and it really can be quite a high dosage of anxiety, rather than the physical symptom itself, results in severe distress that can disrupt your life. Just imagine having an imaginary illness, not a real physical illness, but imaginary. Now, illness anxiety disorder is a long term condition that can fluctuate in severity. It may increase with age or during times of stress. For example, when you have extremely high volume of workload, example in the times of such pandemic. But psychological counseling, psychotherapy, and sometimes medication can help ease your worries, which will be of great help to the afflicted. Now, hypochondria. People previously diagnosed with hypochondriasis may be diagnosed as having illness anxiety disorder, in which the focus of the fear and the worry is on uncomfortable or unusual physical sensations, being an indication of a serious medical condition. Note, it is actually not actual physical sensation, but actually imaginary ones. On the other hand, somatic symptom disorder, a related disorder, involves focusing on the disabling nature of physical symptoms, such as pain or dizziness, without the worry that these symptoms represent a specific illness. So, what are symptoms? Symptoms of illness anxiety disorder involve preoccupation with the idea that you are seriously ill, means you are constantly thinking about this and having a worry based on normal body sensations, and I repeat, normal body sensations, such as a noisy stomach, or minor signs such as a minor rash. Signs and symptoms may include being preoccupied with having a serious disease or health condition. Worrying that minor symptoms or body sensations mean you have a serious illness. Being easily alarmed about your health status. Finding little or no reassurance from the doctor's visits or negative test results, which means even if the doctor says that there is nothing wrong with you, you still cannot get rid of your worry or disorder or anxiety. Now, worrying excessively about specific medical condition or your risk of developing a medical condition because it runs in your family. It means hereditary. Having so much distress about possible illnesses that it's hard for you to function. You are frozen, or actually, you cannot possibly do what you normally do in the normal state. Repeatedly checking your body for signs of illness or disease, frequently making medical appointments for reassurance, or avoiding medical care for fear of being diagnosed with a serious illness. Avoid people, places, or activities for fear of health risks. Constantly talking about your health and possible illnesses. Frequently searching the internet for causes of symptoms or possible illnesses. Now, when should you see a doctor? Because symptoms can be related to health problems, it's important to be evaluated by your primary care provider or your family doctor, if this hasn't already been done. If your provider believes that you may have illnesses, anxiety disorder, he or she may refer you to a mental health professional, a psychotherapist. Now, caring for a loved person. Now, significant health anxiety can cause real distress for the person, and reassurance isn't always helpful. Sometimes providing reassurance can make things worse. This can be frustrating and cause stress on families and relationships. Now, encourage your loved one to consider a mental health referral to learn ways to cope with illness, anxiety, disorder. Because sometimes we cannot actually manage it ourselves, neither can the person concerned. So it's best to get someone who is a medical professional to help out. Now, causes. What actually causes illness, anxiety disorder? But it's not really clear. But these are the factors that may play a role. The beliefs. You may have a difficult time tolerating uncertainty over uncomfortable or unusual body sensations. This could lead you to misinterpret that all body sensations are serious, so you keep looking for evidence to confirm that you have a serious disease. Now, you are maybe more likely to have health anxiety if you had parents who worried too much about their own health or your health. Past experience. You may have had experience with serious illness in childhood, so the physical sensations may be frightening to you. So these are all memories of bad experiences. Now, what are the actual risk factors? Illness, anxiety disorder usually begins in early or middle adulthood and may get worse with age. Often for older individuals, health-related anxiety may focus on the fear of losing their memory. Risk factors for illness, anxiety disorder may include a time of major life stress, threat of a serious illness that turns out not to be serious, history of abuse as a child, a serious childhood illness, or a parent with a serious illness, so the memory of it remains. Now, personality traits such as having a tendency towards being a worrier or what I call introvert, excessive health-related internet use, which means keep searching or googling for health issues just to be on the safe side by actually creating more worries for yourself when you cannot handle or manage it. Now, what are complications? Illness, anxiety disorder may be associated with relationship or family problems because worrying too much can frustrate others. Now, work-related performance problems or excessive absences due to this disorder. Now, problems functioning in daily life, often resulting in a disability. Financial problems due to excessive healthcare visits and medical bills. And if you're working in an office, then of course you may be asked by your HR what's the reason that you keep going to see the doctor or going for a full medical exam. Having another mental health disorder such as somatic system disorder or other anxiety disorders, depression, or a personality disorder. What can you do to prevent this? Little is known about how to prevent this illness, anxiety disorder, but these suggestions may be helpful. If you have problems with anxiety, seek professional advice as soon as possible to help stop symptoms from getting worse and impairing your quality of life to the point that you are frozen. Learn to recognize when you're stressed and how this affects your body, and practice stress management and relaxation techniques, even meditation, yoga, listening to relaxation music, whatever it is that you find helps you. Now stick with your treatment plan to help prevent relapses or the worsening of the symptoms.